An asymptomatic 25-year-old physically fit male underwent a routine ECG which showed bradycardia, a slightly irregular rhythm with some beat to beat variation in the heart rate varying between 50 to 55 beats per minute. Each QRS is preceded by a P wave, which are of different morphologies, and the PR interval is also short and sometimes quite immeasurable, as in beat 5 of this strip. When we move to the second half of the rhythm strip, again you see the same varying morphologies of P waves and the varying PR intervals. In the first two beats, in fact, it is difficult to discern the P wave, but when you see V2 of the same tracing, you see that there are distinct P waves seen. In a separate tracing taken a few minutes later, all QRS complexes are preceded by identical P waves. The PR interval is around 120 milliseconds and homogeneous, and this pattern is repeated throughout the tracing. And in one part of the tracing, there is slight variation in the RR interval, which is most likely due to respiratory sinus arrhythmia, and this tracing is therefore consistent with sinus rhythm. So, the rhythm in this ECG is a wandering atrial pacemaker in which, due to high vagal tone, impulse generation shifts from the SA node to other sites in the atria. It is a benign finding and needs no treatment.